So, the general symptoms are typically going to be fever, cough, shortness of breath, but what we've been seeing more of lately is actually more just kind of general allergy type symptoms, sinusitis, head cold, pressure, sore throat, and sometimes the symptoms can start quite mild, but we've seen several patients who started that way and then progressed and ended up hospitalized. When we first started this back in March, most of the patients getting admitted were older, in their 60s and 70s, but interestingly, lately we've been seeing patients actually in their 20s and 30s. Now that doesn't make up the majority, but we've been seeing patients who have been doing, going to bars, patients who have gone rafting, all the things that Governor Abbott has now shut down. We have proven these patients now have contracted coronavirus and ended up hospitalized from it. So for the patients who are hospitalized but are not in critical care, we're currently using a variety of treatments. The number one is a medicine called dexamethasone, which is a steroid, which a recent study has shown does offer some benefit, but I think it's important to note that it only offers a benefit in patients requiring oxygen. And so any patient in the outpatient setting who has coronavirus should not be on this medicine specifically to treat coronavirus unless they're requiring oxygen. So there's a variety of reasons why a patient may need to be on a ventilator. The number one reason would be their oxygen levels are too low, but also sometimes patients are tiring out. They're breathing so fast that their body can't keep up. I describe it as they're running a marathon while they're just laying there, and hour after hour of that, eventually the body can give out. So for patients typically in critical care in our ICU, they're typically there because they're experiencing severe shortness of breath and their oxygen levels are dropping too low where a normal ventilation is not sufficient. We're also seeing that a lot of them are getting very confused and kind of out of it, and that's also in medicine a sign of overall deterioration. With our patients hospitalized here at Shannon, the two biggest comorbidities that I'm seeing in my practice are patients who have diabetes and patients who have obesity. Interestingly, we're seeing some of the younger patients, they have diabetes that was previously not a big deal, very well controlled, but now with coronavirus, their blood sugars are markedly elevated. So I think it's important to note for our coronavirus patients that we have seen some patients who previously were not aware of a diagnosis of diabetes that was newly diagnosed when they came in with coronavirus. So there could be young people in the community who do have medical comorbidities that just haven't even been diagnosed that does increase their risk.